I'm sure you people know a lot about COVID-19. So today, let's not talk about coronavirus or its disease. Instead, let's talk about the most notorious fungal infection, commonly called the Black Fungus. Well, this name is making rounds on social media. What is this disease actually? What is its actual name? We call it rhino-orbital cerebral Mucor mycosis. Why does it have such a huge name? That's because it involves or it affects your nose, your sinuses, your orbit, your eye, and your brains, sometimes even your oral cavity. And what is the fungus causing this disease? What organism is it? We call it the Rhizopus oryzae, which is mostly seen in topical and subtopical regions across the globe. Today, unfortunately, the number of cases for Mucor mycosis are growing, and 70% of global Mucor cases happen to be located in India and our neighboring countries. So this is a matter of concern to all of us. So what are the risk factors for Mucor mycosis? When do you expect this Mucor mycosis to grab on you? Because this is an opportunistic infection. Initially, All India Institute of Medical Sciences and ICMR had given us a triad of risk factors for Mucor mycosis. This triad was more specific to people with COVID infection or people who have recovered from COVID infection. So this triad said anyone on whom steroids were exploited or excessive steroids were given is susceptible to Mucor mycosis. Who is diabetic, whose blood sugar levels are very high, or sometimes who are in the state of diabetic ketoacidosis, they might be more susceptible to Mucor mycosis. And the third risk factor was not changing water or not using clean water in oxygen flow meters. So this was the old triad given by ICMR and All India Institute of Medical Sciences, a triad of risk factors. Looking into the current numbers, I'm scared this triad given by ICMR and AIIMS has got no weight, because 20% of our Mucor cases, they were never diabetic, and about 25% of them were never on steroids, and around 30% of them were never given oxygen therapy, which means they recovered from COVID just by symptomatic treatment. So then why is this Mucor affecting them? Why are they infected of Mucor mycosis? $1 million question, right? So let me tell you, these fungal spores are present everywhere. I am breathing them, you are breathing them, all of us are breathing them. Only difference between us and these infected patients is that their nasal immunity is very low when compared to ours. And how did their nasal immunity go down? Again, our new triad will come into picture now. Number one, excessive steaming. Just by looking at some stupid WhatsApp messages, you people steam yourself so much. You people steam yourself for like 10 times, 15 times a day. When you inhale so much of hot steam, what will happen to your nasal cilia and your nasal mucosa? It is getting destroyed. This nasal cilia and your nasal mucosa is like your security guard standing at the gate. Now you fire him, any trespasser can easily get into your house. That is what is happening. Please, when you're steaming yourself, steam responsibly. Do not steam using very hot water. Use moderately hot water and steam yourself for once or twice a day. That's it. Do not excessively steam yourself. You are lowering your own nasal immunity. First reason done. Now coming to the second reason, that is not being vaccinated. Vaccine is very important, can keep you safe from a lot of COVID complications and lot of these opportunistic infections. So please get yourself vaccinated when your turn comes and stay safe. Vaccine is done, so we're done with two aspects of our triad. Now the third one, the most notorious one, that's the new mutant variant of COVID. This new mutant variants of COVID have got some affinity towards opportunistic infections, more specifically towards Mucor mycosis. When I told you the figures initially, I missed out another figure. About 20% of our Mucor cases, they never knew that they were COVID positive, which means they were COVID positive, but their RT-PCR always showed them negative report. That is the classic feature of these mutant variants of COVID now. It does not surface itself on your RT-PCR. So please be careful. Please take care of these aspects. These are the new triad. Now, okay, we have learnt about this triad and everything. Now, how do we manage this mucormycosis? Let me tell you, prevention is always better than cure. How do we prevent ourselves from mucormycosis? Early diagnosis and self-diagnosis is the key to it. You need to look for the early signs of mucormycosis. As soon as you find these early signs of mucormycosis, reach for help. Contact your doctor or contact your COVID helpline or any other health system that is active in your locality. What are these early signs? How do we find them? Early signs of mucormycosis are swelling and pain on one side of your face. When I say pain, it is not blunt pain. It is neuralgic, severe pain. Very severe pain will be there. So it is going to affect one side of your face. You will have facial swelling and pain in the face or in the orbit. You will have retroorbital pain, which means sometimes you might also have pain behind the eye. And in addition to this, you might have some discharge from your nose. And this discharge could be brownish black color. It could be foul smelling also. And you might also see some ulcerations, blackish brown ulcerations in your oral cavity or in your nasal cavity. And one more early sign is bleeding nose. If you see any of these early signs, please do reach out for help. Self-diagnosis is done. Now, how do you diagnose, doctor? Fine, you have told us what to do for self-diagnosis. Now, how do you people diagnose? See, we either take a swab and then send it to your microbiology lab, or we take a biopsy and then send it to the histopathology lab. That is one part. And the other part is imaging. Imaging is something that I love as a clinician. We depend more on imaging because we want to analyze the extent of the infection. So imaging, I prefer a CT scan or an MRI. Our radiologists are considered to be photographers in medicine. So I ask my photographers to give me certain field. What is that? What are those images? I ask them for the orbit, for the sinuses and for the brain. So if I have these three images, then I am very happy. Okay, we have got 40 cases of mucormycosis in our center now. And what are the basic findings that we have seen? Till now we have seen findings like some inflammatory changes in their ethmoid sinus, in their cavernous sinus and in the orbit. And very rarely we have seen some inflammatory changes in the frontal sinus. So this is what we have seen till now. This is done, diagnosis is done, we have diagnosed it. Now, how do you treat it, doctor? Depending on the severity and the extent of infection, we either choose the conservative management or the surgical management, that's the radical management. In conservative management, we give you antifungal drugs like amphotericin B. Coming to your surgical management, this is where your ENT surgeons, your eye surgeons, that's your ophthalmologists, and your neurosurgeons, sometimes even your maxillofacial surgeons, give their efforts and they remove these infected parts. So this is all about the management. Now let's look into the prognosis. What is the survival rate after management? The survival rate that we have observed after management is 59%. If there is no treatment given, then survival rate in such patients is hardly 15 to 20%. So whenever you see these early signs of mucormycosis, I request you, please go consult your doctor and follow his advice. Namaskar.